Welcome to this COSHH awareness training session. Brought to you by S&E CareTrade. COSHH is about promoting the safe use of chemicals in cleaning. The aim of COSHH is to protect people against risks to their health, whether immediate or delayed, from substances hazardous to health, arising from a work activity. COSHH is a legal objective and requirement. This presentation offers an overview to help you understand. 1. Chemical application. 2. Appropriate usage. And 3. Personal protective equipment. It is the law that requires employers to control substances that have the potential to cause harm. However, it is not solely the responsibility of the employer. The supplier has the responsibility to classify and label products in accordance with government regulations. They must ensure correct product labeling and display the relevant hazard warning symbols where applicable. The supplier is also required to provide safety data sheets for each chemical product. It is therefore the responsibility of the supplier to ensure a chemical is safe for its intended purpose. The employer is responsible for ensuring health and safety in the workplace. It is their job to carry out and document risk assessments, provide information and training, and implement control measures and/or procedures. The employer is essentially responsible for how the chemical is stored, used, or disposed of for any given task at any given location. Finally, it is your responsibility as an employee to protect yourself and others in the workplace. You should comply with your employer's control measures and procedures. Use safety equipment and protective clothing. Know safety precautions. Adopt good practice for safe handling of chemicals. And report any spillages, accidents, or concerns. COSHH is everyone's responsibility. We are all responsible for complying with COSHH. Ignorance of the law is no defense. Therefore, it is important that you fully understand your responsibility, not only to ensure your safety and your colleagues' safety, but also to avoid breaking the law. COSHH stands for Control of Substances Hazardous to Health. And it's there to enforce and raise safety standards in the workplace, thereby reducing the frequency and severity of accidents involving chemicals and other hazardous substances. At its core, COSHH is about identifying the hazard of a substance and then determining the risk involved. When we talk about a hazard, we are referring to the potential of a substance to cause you harm. Risk, on the other hand, is defined as the likelihood that it will harm you in use. How great the risk is depends upon several factors, including the hazard, how it is used, how it is controlled, who is exposed, how much exposure occurs, how long the exposure lasts, and the task that is being performed. Before you use a chemical, you should know 1. What the product is called. 2. The strength it should be used at. 3. What that chemical does. 4. How it is intended to be used or applied. 5. Where the COSHH information is kept. And 6. Where the PPE is kept and how to use it. Remember, identify the hazard and determine the risk. Classification, labeling and packaging symbols are standardized pictograms used to indicate the hazards associated with chemicals, ensuring clear and consistent warnings for safe handling and storage. These CLP hazard pictograms appear in the shape of a diamond with a distinctive red border and white background. Do you recognize any of these symbols? The first symbol has a flame inside it. This means the product is highly flammable. The second one is the symbol for corrosion. The symbol with the exclamation mark means the substance is hazardous to health and to the ozone layer. The skull and crossbone symbol means acute toxicity. The next symbol, which shows the upper torso, tells us that the chemical poses a serious health hazard. The symbol displaying a fish, with a tree in the background, lets us know that this product is hazardous to the environment. The symbol of a gas cylinder warns of gas under pressure. And the symbol illustrating a flame over a circle stands for oxidizing. And finally, the last symbol shows a picture of an exploding bomb. This warns us that the product is explosive. When it comes to protecting yourself should a harmful substance come into contact with any part of your body, PPE is essential. You must make full use of any PPE which is provided for your use. Always use the PPE specified on the product label. It is important to remember that PPE is a precaution, and it is there to reduce the risk of harm to you. As previously mentioned, it is your employer's responsibility to ensure you have the PPE you need to perform your job. If PPE stocks are low, please inform the relevant person in your organization. This next part of this video concerns the rules for handling chemicals. The golden rules of chemical safety. You should always treat all chemicals with respect. And don't get complacent. Always wear protective equipment. Use eye protection, gloves, and protective workwear, etc. Always obey instructions supplied with the chemicals and refer to labels and safety literature. Always replace closures on containers. Always store chemicals correctly. Always ensure that safe systems of work are implemented whenever chemicals are handled. Always know the emergency first aid procedures. And finally, always pay attention to the particular hazards of individual chemicals. Always avoid contact with chemicals. Protect the skin and eyes. And avoid swallowing or inhaling. Never indulge in horseplay. Never smoke, eat or drink near chemicals. And never, ever mix chemicals unless specialized knowledge is available. Now, to the do's and don'ts of handling chemicals. Do keep chemicals in a secure and locked room. Use the correct chemical for the task being carried out. Always wear rubber gloves and protective glasses, and inform your supervisor or manager of any accidents or chemical spillages. Thoroughly wash your hands after using chemicals. Follow the directions for use on the labeled product guidance sheet. Ensure work areas are well ventilated when using chemicals. Thoroughly wash out any buckets after use. Rinse and clean any equipment following application. Report any faulty or leaking containers. Ensure eye wash facilities are nearby when handling concentrates. And follow emergency and first aid procedures in the event of an accident. When it comes to the safe handling of chemicals, you should not do the following. Do not use chemicals you are not trained to use. Don't mix chemicals under any circumstances. Don't leave chemicals in unmarked containers. Don't put chemicals into other incorrect containers. Don't spray aerosols onto hot surfaces. Don't leave chemicals unattended. Don't deviate from the manufacturer's instructions. Don't use chemicals other than those approved. And do not issue chemicals to unauthorized persons. The last chapter in this video is about the first aid measures you should follow in the event of an accident with a hazardous substance. If a chemical has come into contact with your eyes, the first thing to do is to remove contact lenses if you are wearing them, and if it is easy to do so. Then, you should rinse your eyes immediately with plenty of clean water for at least 10 minutes whilst holding the eyelids open. After that, if irritation persists, seek medical advice. It is also helpful if you can find out what the chemical solution is composed of so that you can tell the paramedic or doctor. If a chemical has come in contact with the skin, these are some of the steps you should follow immediately after. Firstly, rinse the affected area with clean water. If a first aider is helping, they should ensure they are wearing suitable protective gloves. While rinsing the affected area, carefully remove any contaminated clothing or jewelry, unless it is attached to the skin. Continue rinsing for 20 minutes. Once rinsed, the first aider should keep the person warm using a blanket or layers of clothing, avoiding the injured area. At that point, if irritation persists or if the wound is more serious, it is important to seek medical advice as quickly as possible. Again, it is helpful for the paramedic or doctor to know exactly what chemicals have come into contact with the skin. If a chemical has been ingested, have the affected person spit out any chemical that may be in their mouth. But never induce vomiting. Then seek medical advice and stay with the person as their condition may get worse. Lastly, if someone has inhaled a toxic chemical, move the casualty away from the source of vapor, spray, or mist, preferably to fresh air. Please ensure you are wearing the appropriate PPE before doing so. Keep the casualty warm and at rest, and seek medical advice. To help you comply with the regulations set by your governing body, we have developed a COSHH resources pack that contains material safety data sheets for all of the chemicals in the Concepto range, product posters that advise you how to use a particular product and the safety precautions to be taken whilst using that product, as well as dilution rates. A standard operating procedures book for best practice on cleaning your nursing home is also included, as are posters to display in each type of cleaning zone, to complement the color-coded system in place, to minimize cross-contamination.